I would suggest that we maybe start in 2 minutes. So I will ask the colleagues to kindly close your videos. I will also close mine, and Milan will start the event. Oh, perfect.
Yeah, I was there. I was following your instructions on switching off my camera.
Thank you, Maria.
Good morning, Maria. Thank you.
Good morning. Good morning.
Okay. I have the option to switch it on, but I'll let Nasser do it.
That's perfect. That's perfect. So I would suggest we then start. Nusairi, could you please start the webinar for us?
Okay.
Perfect. Thank you.
Done.
Recording in progress.
Great. Greetings to all. Thank you so much for joining this session addressing sustainable transport system, climate action, and healthy urban environments. First of all, welcome to all our guests online, but also to those attending from Glasgow. My name is Milan, and I'm on the WHO team from Geneva today supporting this session. We are very grateful for the opportunity to be here at the COP26 and would like to thank all the organizing teams making this possible. We are particularly thankful to our co-host, the member state of Argentina, our board of panelists, and the staff working really hard at the Health Pavilion today. We are holding this session in a very timely manner. As you know, the COP agenda will go on to address transport tomorrow, and then cities, regions, and the built environment on Wednesday, the day after tomorrow, on the 10th of November. As we start, I will now present a quick rundown of the agenda. We shall kick off with a video from the Honorable Minister of Health of Argentina. We will then welcome opening remarks from the WHO with Dr. Maria Nera, the Director of Environment, Climate Change and Health. The highlight of our session today will be soft launches of 2 flagship projects. The first is the global update of the HEAT tool, the Health Economic Assessment tool for cycling and walking, and the second, the Climate City Profiles project. After this, we shall move on to our keynote presentation, followed by a panel discussion with an impressive board of experts, as you can see. During the panel discussion, the audience is also welcome to participate using the chat box. The questions will be brought in throughout and appropriated by the moderator. And again, we thank you all for being here today. With no further ado, we'll hear from the Health Minister of Argentina. Thank you.
Buenos días, buenas tardes a todos y todas. Agradezco profundamente a la Organización Mundial de la Salud por la invitación, al Reino Unido por ser anfitrión de este importante evento, a los países, las organizaciones participantes, a los panelistas y a todos los y las presentes. Como afirmó el secretario general de la ONU, la pandemia de COVID-19 ha puesto de manifiesto, entre otras cuestiones, que el transporte es mucho más que un medio para llevar a las personas y las mercancías de un punto a otro. De hecho, es fundamental para la aplicación de la Agenda 2030 en el desarrollo sostenible y el Acuerdo de París sobre el cambio climático. La Agenda 2030 y el Acuerdo de París son ejes fundamentales de la Agenda de Cambio Climático Nacional y de los compromisos asumidos de nuestro país con la limitación de emisiones de gases de efecto invernadero en la actualización de la segunda NDC. La nueva meta nacional de mitigación es absoluta, incondicional y aplicable a todos los sectores de la economía. A través de ella, el país se compromete a no exceder la emisión neta de 359 millones de toneladas de dióxido de carbono equivalente en el año 2030, lo que equivale a una disminución total del 19% de las emisiones en comparación con el máximo histórico de emisiones alcanzadas en el año 2007 y una reducción del 26% respecto de la NDC anterior. El Ministerio de Salud, por su parte, viene desempeñando desde el año 2008 un rol de liderazgo en torno a las acciones de adaptación y mitigación en cambio climático a partir de la necesidad de dar respuestas del sector salud a los efectos que provoca esta problemática. A través del Programa Nacional de Reducción de Riesgos para la Salud asociados al cambio climático, el Ministerio de Salud implementa intervenciones de política sanitaria con el objetivo de afrontar los desafíos de cambio climático, contribuir a reducir los riesgos para la salud relacionados con el clima a través de la implementación de medidas de promoción y protección de la salud y fortalecer la capacidad del sector salud para asegurar el funcionamiento adecuado de los servicios de salud durante emergencias y desastres climáticos fue nuestra prioridad. Es por todo ello que en el año 2020 presentamos la segunda contribución al país, a nivel país, incluyendo por primera vez la dimensión salud. Allí se destaca la transversalización del enfoque de salud y su consideración como uno de los ejes rectores considerados pilares integrales para la definición e implementación de la contribución determinada a nivel nacional. En conjunto con la Organización Panamericana de la Salud, financiado por el Fondo Verde del Clima, se aprobó el proyecto Readiness, incrementar las capacidades del sector salud y fortalecer la coordinación en la acción climática en Argentina a nivel nacional y subnacional, con el objetivo de poder contar con un sistema de salud resiliente al clima, bajo en emisiones, basado en la evidencia científica, que cuente con las capacidades institucionales y técnicas adecuadas y esté plenamente integrado con otros sectores para preparar planes de inversión hacia un desarrollo sostenible descarbonizado. El sector salud figura tanto en la segunda NDC como en el Plan Nacional de Adaptación y Mitigación como eje rector, siendo una dimensión a considerar en las políticas sectoriales para el cambio climático. Repensar la forma en la que los sistemas de transporte urbanos están organizados para una vida mejor y un desarrollo sostenible en las ciudades, incluso en el contexto de la pandemia COVID-19, debe ser un trabajo multisectorial que contemple la integración del sector salud en el transporte y la planificación urbana. Muchas gracias.
Great. So we would like to thank our co-host, the member state of Argentina, one more for supporting this event. Now I'd like to welcome the remarks from the WHO Director, Dr. Maria Nera. Maria, the floor is yours. Thank you.
Thank you very much. And it's really a great pleasure to hear such a powerful words from Argentina Minister, and maybe I should say it in Spanish, at least thanking her. Muchísimas gracias, me encantó la intervención. Realmente ese es el programa que tenemos que tener para incorporar la salud dentro de esta planificación urbana saludable. Let me switch to English again and thank you all the co-hosts and the organizers and all the participants to this session. For us, a sustainable transport system is fundamental for what we call the healthy urban planning. As you know, a few months ago, we launched already what we call it the Manifesto for a Healthy and Green Recovery. And for us, all the way we will be designing, planning strategically our urban environment on a healthy way, on a green way, on a logic way, on a way that will protect from incidents, to a more active lifestyle, to having access to green areas, to making sure that our sustainable transport, a transport that will respond to the needs of the people, making sure that it's not just having electric cars and replacing the cars we have now by electric cars. It's much more than that. It's a healthy, urban, sustainable transport, responding to the needs with acceptable and affordable to everyone, responding to the commuting needs that we have in the urban areas, and particularly protecting the health of the people. If we do so, we could obtain so many health benefits. I'm very happy to be here today as well to promote the HEAT. I think you heard so many times probably what is this tool, this important tool on the health and economic assessment. Essentially what this is about giving the policymakers the options they need to assess how climate change and about the poor urban planning will affect the health of their people, and how transport, a sustainable transport, will be fundamental in all of that. HEAT is a tool, and if we use it, I think we can say that no excuses. I mean, no policymaker will have excuses to say, I didn't know how to do it. The other launch, I'm sure you hear more later on about, is this city profiles, and I'm sure that other panelists will have the opportunity to talk about. Thank you again, because I think we are moving, and if we have to move in this agenda on the transport, I suppose we need to move safely, looking at how we do this transition to cleaner sources of energy on our transport systems. And the health sector is very much ready as well to collect, to quantify the so many health benefits that will be generated from an environment, a healthy environment, a urban environment where our health will be so much protected, and we can, as I say, create so many health benefits. Thank you all. I pass now the word to Tiago, my colleague, Tiago de Sá, who will be giving you much more technical information and more precise on what we are planning to do. But thank you so much. WHO is very happy to be part of this, and I wish you a very successful panel. Over. Tiago, we can see your slide, but we can't hear you.
Thank you, Maria. Can you hear me now?
Yes, we can hear you and see your smiling face. Go for it.
Perfect. That's perfect. Now, what I was saying before is just now again to reinforce the message that for us it's an immense pleasure to join this conversation today and discuss on how that we could deliver simultaneously on sustainable transport systems, on climate action, and on healthy urban environments, all very relevant agendas that we should tackle at the same time in an efficient manner. And I would like to start this keynote presentation just highlighting that the relation between urban transport, environment, and health is not necessarily new. This is the image of a typical street on a large urban center back in the 19th century, full of horse manure, unbearable stench, clouds of flies, poor sanitary conditions, noise pollution coming from the metal horseshoes and the iron ringed wheels. Just to give you an idea, in 1880, around 50,000 dead horses had to be removed from the streets of New York every year. So it's not surprising that it was clear for most people back then that a very sophisticated invention, the automobile, seemed to be the perfect solution for many of those problems. Now, the next chapters of this story are well known to everyone. The combination of over-reliance in motorized private vehicles moved by fossil fuels, together with a poor process of urbanization, privileging a minority in the city, and deepening a spatial segregation has led us to unsustainable transport systems where the majority of the population is either dispossessed of any mobility option other than walking, or pushed to buy motorcycles and cars to overcome long distances and the lack of access to public transport. Now, it is a lose-lose situation. with some losing more than others, but even those that in principle would benefit from the way that cities are organized are also having to deal with air and noise pollution, traffic jams, time loss, water and soil contamination coming from transport, just to name a few links between transport and health when it comes to the negative impacts. When we look at the tailpipe emissions, for example, we see an estimate of almost 400,000 premature deaths and $1 trillion in health damages globally. This without considering road resuspension and tire wear, which actually form most of the air pollution coming from transport, even in many high-income areas. And this is important because the electrification of private vehicles will only solve the first circle up there. Now, if we add road traffic injuries and other related health impacts to this equation, the situation gets much worse when it comes to the health and the health inequity impacts related to transport. But we also know that transport systems and urban environments, they are closely linked to several positive determinants of health, from opportunities to physical activity, to access to jobs, education, and healthcare, to the independent mobility and the ways children can learn from moving independently in the city, food security, sense of community. These are all very relevant, and these are determinants of health that will impact not only the health of a single person, but also of their families and also the generations from that family to come. Now, another important aspect for us to highlight is that several of the policies and interventions able to reduce transport greenhouse gas emissions also have the potential to promote health, well-being, and economic prosperity if they account for that through the planning and implementation of these interventions. Now, as Maria mentioned, there is absolutely no reason for not considering the integration of health in urban and transport policies. And today we have a solid body of evidence and a library of tools, such as the Health and Economic Assessment Tool for Walking and Cycling, to facilitate the integrated assessment of the health, climate, and economic impacts of transport and urban interventions, looking at air pollution, physical activity, road traffic injuries, and carbon emissions at the same time. Now, we also know that these tools, they have little use if they do not get to the hands of the urban leaders, of the policymakers, of the communities at the local level. So when my colleagues in Accra from the health, the transport, the environment, and the many other sectors came together under WHO's Urban Health Initiative to adapt and use such tools, they have shown that fulfilling their vision of a truly sustainable transport system for the city, the one with increases in public transport use, better infrastructure for walking and cycling, cleaner fuels and technologies, and less reliance on cars, that vision would deliver massive health, climate, and economic benefits for the years to come. And this type of health evidence produced by local stakeholders to support local action has also been informing several relevant climate-related plans and interventions for the city. Now, at the same time, we know that despite being on the front line, cities are historically under-resourced. They are juggling competing priorities. They are facing challenges to implement this type of vision that you just heard from the experience of Accra. And I truly believe that it is our role to help cities and citizens to understand what their situation is, how prepared they are to act on climate, health, and sustainable development. And I believe that our health and climate change city profile can contribute, which we're also gladly launching today, can offer a very interesting snapshot of the city for us to better understand Now, what's the status of the connections between health and climate? And of course, help the cities and the citizens to strengthen their case for action, to address these issues in the most effective way. Now, we know what to do and we have the tools and the expertise for that, but time is urgent and we should act now to create healthy and sustainable transport and urban environments for all. And it is precisely for this reason that we invited today a very strong lineup of colleagues, for them to share their experience and their expertise with us. Dominique Alba could not join us today, but we have the pleasure to have with us Olivier Richard, which is the Director of Studies, also with the Paris Agency Urbanism Agency, I'm sorry. We also have with us today Sandra Swanson from the CDP Cities, and Sandra is the Senior Manager for Urban Health. We have with us Heather Thompson, which is the Chief Executive Officer from the Institute for Transportation and Development Policy, ITDP. Mohamed Mesgani, the Secretary General of the International Association of Public Transport, UITP, and Natalia Jaras, which is the Healthy City Lead for the Viva Mi Calle project at Despacio in Colombia. And you will have the bio of all my colleagues in detail in the page of the event. So I will stop my presentation now and jump straight to the panel. And I would like to invite our speakers to put their videos on for us to start this conversation. So this is excellent. I see all the colleagues now with us. And if you allow me, I would like to start with Olivier. Olivier, it's a pleasure to have you with us today.
Thank you, Thiago. It's also a pleasure to be here. Thank you for this invitation. And I would also like to apologize Dominique Alba, our director, who was unable to attend this event due to a last-minute emergency.
Thank you, Olivier. Well, it's great that we have you with us today, and I would like to start, just by saying that Paris has historically been one of the cities now at the forefront of rethinking our urban environments, and your agency has been playing like a pivotal role in positioning Paris as a blueprint for urban sustainability. Now, looking at these different concepts, such as the 15-minute city, and also interventions to increase livability. Health is livability. So, sure. Olivier, could you please tell us a bit more on what is this vision of Paris in regards to bringing health, climate, and the transport agenda together? And if I may add now, which are the adaptations that you would see other cities would need to make to translate some of these innovative concepts from Paris to their local context?
Okay. Well, as you told, Thiago, so I'm working in APUR, which is the urban planning agency of Paris. I should point the stress on the fact that I'm not the city of Paris. I'm just an agency, independent agency, but funded by public partners like the city of Paris. So our aim is to help our members, so the city of Paris, the metropolis of Grand Paris also, to anticipate major challenges, the major issues that such metropolis face and will still face. And that's what we are dealing with, transport, air, and climate issues. Just to be quite short, I won't talk about everything we did, all the concept, but I would stress the point over space, because it's the base for us, for urbanism. And I would put the stress through 2 points, which are emblematic of the vision we had in Paris over these issues. The first one concerns the issue of the space dedicated to cars and its evolution over the last decades. This is a central issue. This is a key lever for Paris, but also for other cities everywhere in the world. Without going back over the recent history of mobility in Paris in 20 years, we changed radically from a situation which was always more spaces for cars to let's optimize public space in a more sustainable way. What did we use? Just to give you a sample of the tools we used. First of all, we used temporary closure of streets on roads to road traffic for the benefit of workers, of cyclists. It's really important because it allows a change of image of the space and a reappropriation of such a space by the users. Just to give you an iconic example we had in Paris, it's the banks of the Seine. Before an highway, which were closed on Sundays for the last 20 years. Then from 2001 for 3 weeks during the summer, and it was a kind of beach over the Seine River in Paris. And since 2016, it's closed forever to traffic and it's turned into a park. So just to give you an idea how we can use these temporary uses of spaces. Another tool is to play on share of public space between space dedicated to cars and space dedicated to other modes. Each time we can, in each opportunity. It allows us to implement bicycle lanes, for example, but also to improve sidewalks for walkers and also to favor surface public transport. Even if Paris is has a very good metro system, as some of you know. Other tools we use are also to change the way we use cars. They have to be less polluting. So that's why we settled low emission zones in 2017, and we are aiming to ban diesel cars in 2024 and thermic cars by 2030. So that's a huge challenge we are facing. We are also promoting car sharing because we know that we have to use cars, less polluting cars, but also we have to share to have less cars in the final. And we are also to develop alternative energies, such as electric hubs in the city, such as biogas station or hydrogen station in the city. What are the results of all that? First of all, it's a strong decrease of car traffic, but also of air pollution. So it's less 40% of car traffic in Paris in about 10 years. It's also 14% of decrease of greenhouse gases dedicated to mobility in Paris from 2004 to 2017, so in a bit more than 10 years. We also divide by 3 the number of people, the number of population exposed to pollution, to over the limits daily recommended by the WHO, but we still have 500,000 of people which are still exposed above this limit values. And another result is that Parisians have fewer and fewer cars. In 2000, half of the Parisian households had a car. Now there are just 1/3. So it's less and less cars, and it allows us to change the city. We are planning to recover half of the parking lots in the streets of Paris. It's about 70,000 of parking lots which we will recover in the next 5 years. And why? To plant trees, for example, and then to fight urban heat islands, because it's also an increasing issue that we are facing, such as other cities. But we will also have other facilities, other like containers to better sort waste, etc., etc. So that's why I wanted to put the stress on the space of cars, because I think it's a key lever in Paris, but not only in Paris, everywhere in the world. The one other issue I wanted to talk is also the land use. And you mentioned the 15-minute city. Of course, we have to improve the proximity in the city. We have to improve the mixity. And by mixity, I want to speak about functional mixity, but also social mixity, because it has also to be linked with inclusivity. So that's why we mean by the concept of this 15-minute city, which is a place where you can find everything you need every day within 15 minutes of your home. So to go shopping, to go walking, to have fun, to play sport, etc., etc. So it means giving access to a common base of services that constitutes this 15-minute city. So how to find the ways? Of course, we have to play on the land use, but we think that in Paris, we don't have to build facilities. We don't have to build and build and build. We just have to better use what we already have. For example, to allow several uses, several activities in a place that you just had one before, like schools, opening schools on Saturdays. That's what we started on last year. So we have to optimize the space and the uses. So these issues are quite universal, I think. And the proposals we followed in Paris can be driven in all the other cities. Of course, they have to be adapted because Paris is very dense. It's already almost a 15-minute city, but we are mainly speaking about a better use of things, a better use of buildings, a better use of the space. And that's what we think that it's one of the ways to offer a better livable city.
That's very interesting, Olivier. Thank you very much. It's an impressive list of actions that you're taking. And you mentioned the co-creation of space, inclusivity. So what we do with this urban land and who has a stake in what we do with this urban land. And I think that this is an important point. So now maybe just to bring to this discussion somebody that has been working closely in helping to give voice to those that usually are not part of this discussion, I would like to have Natalia in this conversation. Natalia, hi.
Hi, how are you?
Very good. Thank you for joining us. And Natalia, I know that you are on the other side of the ocean. You're not in Paris, and I know that through different initiatives, you've been active, in addressing the barriers for the inclusion of the youth in urban planning, particularly when it comes to health and sustainability. Now, what have you been hearing from the youth? What has the youth proposed as means for us to achieve healthy urban environments that also contribute to climate action? And then how can governments enable this type of participation for us to address, as I mentioned before, transport, climate, urban health agendas concomitantly with the inputs from the youth?
Well, our project is called Vivo Mi Calle, and as you said, is based in Colombia. It's part of Foundation Botnar's Healthy Cities for Adolescents. And what we want to do is we want to improve the health of adolescents through their participation in the creation of public spaces and routes that foster their rights to healthy cities. And when we talk about healthy cities, we talk about sustainable, of course, safe, because of course we need personal safety and road safety in order to promote, for example, active transportation or the bicycle, and also to promote cities where we have, activities, it's, dynamics, and also a gender approach. As women, we live the city in different ways, and we want to make sure that women can actually have a right to the city. So we work with adolescents on this, aiming to basically promote their well-being. One of the main things we do is to promote and as you said, what has the youth, what are their proposals? And one of them is to promote the use of the bicycle. Of course, it increases physical activity, as you said, improves health, reduces stress, and it could cut transport emissions by tons if we increase the modal share in our cities. So we work with children in promoting this. For example, we're currently working in Palmira, a small city in Colombia. where the bicycle share is already 12%, which is very high. I mean, if we compare it to, for example, Bogota is only 6%. In Palmira, we have 12%. And we're working with adolescents in promoting the use of the bicycle. So for this, we're building infrastructure, because this is one of the key things that we need to do in our cities. We need to build infrastructure to make sure, people, we have a switch from one mode of transport to the bicycle. And this is very important, because people that use their bicycle every day, they produce less carbon emissions, like by 84%. So promoting the bicycle is key in our cities, but for this we need to promote infrastructure. We need to make sure the roads are safe. You need to make sure that roads are also safe for women. For example, as I said, in Palmira, we have a model share of the bicycle of 12%, but of this share, only 20% of women use the bicycle. And this is because of personal safety, sexual harassment, and many other things that happen to women that, they're not able to use the bicycle. So to make sure that women are also able to use the bicycle path that we're gonna build, we're doing road safety audits, lighting audits, we're working with the police, we're working on sexual harassment campaigns, and all of this is with the youth. These, they are the ones that tell us the problems or the risks that they face every day when they use the bicycle, when they walk around the city. So we're working with them to improve and to promote the use of the bicycle. And also, I think that the government needs to understand that the youth is, they're citizens. They have the right to participate in urban processes. They have the right to participate in urban planning. They have the right to say what they think and to build or to work together in the construction of that vision of the city, right? So more than saying we need to, more than just having policies sometimes it's all on paper and it looks good, we need actions. So we need to make sure that the key is part of this process. The youth, they want to fight climate change, and they're key. They're great supporters of this. If governments are looking for people that would support, their climate actions, this would be it. It would be the youth. They're also the key to change the mobility paradigm. So we need to start working with the youth in our cities.
Well, that's absolutely, Natalia, and I'm very glad that you brought this expanded understanding on the links between health, climate, and transport. Now, who would say that sexual harassment is also climate action, no? In the context of transport? This is very powerful, and I think that this is the type of integrated approach that we have to look more and more. You also mentioned the right to the city, and the right to the city is transforming the city according to our wishes, but it's also moving around, being able to benefit from the city opportunities. And I can tell you that whether using cable cars in Latin America, buses in Asia, bike sharing systems in Europe, public transport users would likely rely on the services of one of the members of UITP. So that's why I would like to bring Mohammed to this conversation, bring like the transport community now, public transport community, for us to better understand their stake in this. Mohammed, nice to see you.
Hello, Diego. Thank you. Thank you for having me. And by the way, congratulations for this HEAT tool. It's really great to have such a tool that could support decision-making, political decision-making.
It's excellent to hear, Mohammed. And thanks for joining. I'm sure that we will work together to advance on the use of HEAT also with the public transport community. And we know that you are developing, Mohammed, a number of strategies, actions across a wide range of types of systems. And I just mentioned, it's not just about buses and trains. Now, you have a very broad group of public transport operators, service providers. Now, could you please let us know what you feel are the most promising public transport policies, technologies, initiatives for us to shift transport systems towards green development while also improving the resilience of transport systems? And we know how this sector suffered, particularly in the context of COVID, but also climate change is an important element in there. So it would be nice to hear from you on those aspects.
Yes, thanks, Diego. Again, as you said, UITP is not just about buses or trains. It's actually a global association. It's a multi-stakeholder association. So it means we have the authorities, we have the transport operators, the public and private, small and big, and it's also a multimodal association. So trains and buses or rail and road are the conventional modes, I would say, but also it's about waterborne transport in cities. It's about also shared mobility, shared bikes, and ride-hailing, taxis, etc. So we gather the whole ecosystem of urban mobility in the city, and also listening to Natalia. We also have, and with the focus on young people, we also have the Youth for Public Transport Foundation, which is part of UITP, and we are happy to involve them also in the discussion, because it's very important, as you said, and key to hear their views. And so it means it's an ideal platform to discuss with the whole ecosystem on how this sector can contribute to healthy and sustainable mobility. And there is no doubt that public transport brings a lot of positive contributions to this. So if we look at the economic level, I mean, of course, it's about the access to jobs. It's access to more jobs thanks to public transport, access to more skills and the diverse workforce. And we have seen during this pandemic the key role of public transport, the essential role of public transport in providing access to those who have no choice to, and also to the essential workers. So that's important, and we are proud of that. And also public transport is often the first employer in a city. If you take a city like Vienna or Brussels or Amsterdam, public transport is the first employer. So it's the weight of public transport is very important, the economic weight. And also, if we look to compare when we invest in public transport, we can create 25 to 30% more jobs compared to an investment in road infrastructure, for example. So the economic weight is very important. Not to mention, of course, like a city like Paris. I mean, the role of public transport in attracting tourists and in making the movement of tourists easy. So it means the impact on tourism is also very important. Then, if we look to the society at the society level, of course, public transport with offers accessibility for all. It's a tool for social inclusion, of course. And there is a study in Auckland, in New Zealand, showing that the private cars generate social costs for the community, which is 28 times higher than those of public transport. So the social cost is very important. And also, word about road safety. According to the mode, buses are 4 times safer than cars, tramway 6 times safer, metros 10 times safer. If we look to the consequences of accidents in the city. Then there is the environment and the climate angle. Sorry. So public transport is 3 to 5 times more energy efficient and less emitting than cars for each passenger transported. So we should not forget this. And without immediate action, the global share of transport emissions could reach 40% by 2030 compared to the 24% of now. So we need to really to act and to develop more public transport. So, and for that, modal shift is key. It's not just about making public transport modes cleaner and greener and zero emission, because this is very easy to say we want zero emissions vehicles, but it's also about promoting a modal shift towards public transport. And the health benefits, of course, it's about the link to the better air quality and the more physical exercise. But this is, of course, the WHO is leading in this, and I will not teach you anything regarding that. So you mentioned technologies and policies and other initiatives, but for me, technology is not the panacea. We already have all the technology needed to make sustainability happen, but we are still behind the objective. I mean, with all the technology we have, we are still behind the objective. So it means we need to put the focus on policies. We need to put people at the heart of our policies. It's not about technology. If the technology is about having zero emissions vehicles, then I would repeat it again: a green traffic jam is still a traffic jam. It's not because we will turn all our vehicles zero emission that we are going to solve. No, we have to think in terms of accessibility, in terms of efficiency, in terms of social inclusion, health, etc., and so on. So we need policy that make sure we move people and not cars. And I like very much what Olivier said about Paris, which is putting the priority on space, because this is really the challenge we have in our cities. It's about how to use that space and how to give it's about giving the priority to the modes or the solutions that are the most space efficient. And it's what Paris is doing, and many cities, I am sure, should do that. And we know it's about also back to basics. We know that avoid, shift, improve. We know them, we have been knowing them for many years. It's about putting them in practice and not focus on improve only on the technology part of a technology pillar only. So it's about having the right organizational setup in our cities, having the mobility authorities, transport authorities, and unfortunately, there are still a lot of cities that don't have mobility agencies or mobility authorities which are integrating all modes. Having the right skills, so capacity building is very important all over the world. It's key, and also the right partnerships with all the stakeholders, and that's why in UITP we really want the association to be an association for all stakeholders, because partnership is key if we want to fight this climate change issue. Thanks. So that's what I wanted to share with you as an answer to your question. Thanks.
It's mind-blowing, Mohammed. So now you mentioned the need for a strong public transport system. Olivier mentions the need for us to rethink the cities. Natalia brings the issue of accounting for who uses this space, who is not using this space, who has a stake on this space, and maybe we could have health and well-being at the core of these decisions. Now, at the end of the day, we all want to live well. So all that just to say that it doesn't seem to me that it's just about electrifying private vehicles. But let's hear now from Heather. And now Heather is I know that now ITDP has been committed for years now in supporting cities to deliver on sustainable targets, on really in strengthening their capacity to respond to this. You see, it's not simple. Yeah, but we have to acknowledge and embrace that complexity if we want to tackle all these at the same time. And Heather, I know that you're now leading a global cycling campaign to promote cycling, particularly in low and mid-income cities. Now, just heard from Natalia, we need more cycling for women, for all. What are in your view, the promising areas for us to strengthen the capacity building for developing countries and cities to support their path in this direction? And how do you see the integration of health in this work? How we can bring health more closely together to the urban and the transport interventions that we need to put in place, for instance, to promote and protect cycling?
Well, thank you for having me here today. It's really great to be with you all. Yes, ITDP is a nonprofit organization, and we promote sustainable and equitable transportation, all modes of transport, but we're especially excited to be launching our Cycling Cities campaign here at the COP in Glasgow during COP26. Cycling is one of the only truly no carbon modes of transport that is also affordable and accessible for everyone. And as more and more people around the world get less exercises these days, it can also be a healthy form of transport. With our Cycling Cities campaign, we have more than 25 cohort cities joining our campaign. And our goal is to inspire 250 more cities around the world to develop protected cycle lanes so that 25 million more people have access to safe cycling by 2025. And our campaign is joined by cities like Glasgow, Jakarta, Cairo, Manila, Bogota as well. We're very excited. And not the typical cities that you hear so much about, like Amsterdam and Copenhagen. What we really want to do is to help more typical cities that have less resources and have committed fewer years to cycling, and cities in developing countries. And you ask about capacity building. One of the most important things for capacity building is to help cities find ways to advocate for more political commitments to build complete networks of safe cycling lanes. We know that complete networks of protected lanes is really what gets people on their bikes, and so this is essential. This means often collecting evidence that cycle lanes are cost-efficient modes of transportation and evidence that citizens, people actually want to cycle. We need to help city government leaders and civil society organizations learn how to use this evidence for more advocacy and to get financial commitments to build complete networks of protected lanes. So it's great to have the new WHO HEAT tool to help with this, and we look forward to helping cities use the tool. We also need to help cities design networks of bike lanes, protected lanes, and often this means dealing with tricky issues like how to design safe intersections where cycling and walking and car traffic come together. And we also need to help cities teach people how to ride bicycles. And this is especially important for women and children who often cycle less, but can benefit hugely from cycling, as Natalia pointed out earlier for Bogota. During the pandemic, I think so many of us have seen that many more people in cities around the world took to their bicycles because cars were not on the roads and people felt safe to get on their bikes. And this shows that there is demand for cycling. Many cities implemented temporary cycle lanes and are now making those lanes permanent, Paris and Bogota being two of the cities that have done this. So we must take advantage of this momentum and continue the trend, and we can help cities build the capacity to collect the compelling evidence and make the case for more commitments to safe cycle lanes. And this is one of our goals with our new Cycling Cities campaign. So please check out our campaign online at cyclingcities.itdp.org. And we really look forward to working with many of the partners on this call to get many more cities around the world to adopt safe cycle lanes and to use the HEAT tool to make that happen.
That's excellent, Heather. 25 million people. That's impressive. It's great.
It's possible. We've modeled it out. If we get 250 cities on board, we can do it.
It is, and you're right. As an urban cyclist myself for more than 20 years now, and talking to my friends, people don't know how to ride a bike on the streets. They have to learn about it. They have to have access to a bicycle in the first place. They have to have the dedicated infrastructure for them to, for example, reach the public transport system that can then help with the integration of modes, right? We need to work on this all together, and we need to help the cities, as Heather just mentioned, to also take stock and see where they are in this equation when it comes to bringing like all these agendas together. And I know that Sandra, who's here with us, has been working closely with WHO and the CDP, and they've been instrumental in helping us developing the climate health and city profiles, supporting cities, states, and regions to measure and manage the environmental impacts and frame climate change as a public health issue. So transport issues are public health issues, and climate change as well. Now, Sandra, in your capacity now supporting the development of these profiles, what have you learned about the way climate change and health departments work together in cities? And then just a follow-up question is, are there any opportunities or barriers that actually cities face when trying to implement actions jointly? Thanks for having you. It's excellent to have you with us today.
Hi, Diego. Thanks for having me. It's a pleasure to be here. As you've outlined in your keynote, the health and climate change city profiles were developed in recognition of the critical role and influence that subnational actors have in driving action to address climate change, and the duty of care that they have to ensure that the clear and present dangers posed by climate change don't negatively impact health. You've already mentioned that CDP is a global nonprofit that runs the global disclosure system for investors, companies, city, states, and regions, over 10,000 stakeholders globally, over 1,100 city, states, and regions this year alone. They're reporting to CDP on their use of water, land, mitigation adaptation plans, emissions, air quality, food systems, and dozens of other questions we burden them with on an annual basis, and they kindly reply. That gives us a better idea of what they're facing. So CDP believes that you can't manage what you don't measure. And that's a key role that CDP plays in this space. So the aim of this work that CDP supported WHO with partners at SDU was to work directly with cities to co-develop a decision-useful resource that could build a business case for action by highlighting how the city's most pressing climate hazards were likely to impact public health and the kinds of actions that could mitigate those negative impacts. So over the past year, we've been working with initially 5 pilot cities, an additional one to be added shortly, who've been involved in this project. And through this engagement, we've been able to better understand how some climate teams and health teams work together, or perhaps more worryingly, how they're not working together as effectively as they could on the city level. So at this work, again, we're at the pilot stage, so only working with a handful of cities, but nonetheless, it seems very clear that direct collaboration between climate and health teams isn't common or reliable occurrence. In best case scenarios, they may be aware of each other and somewhat familiar with each other's priorities and objectives. But in other cases, there's very little interaction between these different teams and departments, which I'm sure isn't a huge surprise to those on the panel today. So it's certainly our hope that projects like this can help break that silo and encourage greater collaboration between them. So to your second question, talking about opportunities and barriers, thankfully, there's a lot of opportunities. Those are pretty extensive. It's abundantly clear that climate and health teams benefit from direct collaboration at the city level. This opens up new avenues for discussion, aligned action, and planning. Together, cities can look at upstream drivers and downstream effects of climate-related health impacts and align their thinking, their budgets, and their communication to win greater support. It's also clear since the climate and health teams have great synergies in their priorities when they sit in the same room together and talk about those. So, for example, one of the cities we work with have been developing a profile for is the city of Glasgow, and they've made it clear that both the climate and health teams really want to emphasize equity issues in the way that they set their priorities and objectives. And there's a lot they can do to prioritize this when they speak with one united voice. So. And then very obviously, just the strength of the health argument. So the WHO has recently published a special report on climate change and health really makes this case plainly. And from CDP's work engaging thousands of cities globally, we're increasingly seeing opportunities for cities to win greater public support, political support, and critical financial support for their climate action plans, which in many cases are fairly ambitious, but they need to build a better business case to get support for those plans. So by highlighting health and health co-benefits, we think that they have a greater chance of delivering on those plans. Of course, critical gaps also exist. I'll run through those a little bit more quickly, but yeah, they're fairly extensive as well. So there is a need for cities to adequately assess how their planned climate actions explicitly and implicitly include health impacts and health co-benefits. There's potentially even a greater need for improved methods and metrics for the cities to quantify climate health impacts. And I have to add the economic costs of those impacts at the local level. Sometimes that's done at the national level, less so at the local level. Having spent a lot of time looking at the data, it's incredibly challenging to find that. We know that it would really help cities win support if they could illustrate sort of a no regret solutions for the kinds of actions they want to take. And then probably more obviously, the need for policymakers to include climate and health analysis and co-benefit metrics into their decision-making. So in an ideal world, we'd be looking to develop hundreds, if not thousands, of these profiles so that climate and health teams around the world can work together to move on from assessing risks to calling for and delivering action that will protect public health. For now, again, we're working with 5 or 6 cities. We'll see what happens next, but we're looking forward to publishing the profiles shortly and sharing the results in the days ahead.
That's excellent, Sandra. And indeed, now we need to have hundreds, thousands of those, and including the secondary cities, which we know will be the ones, unfortunately, exploding with poor urbanization for the years to come. Now we have 2 minutes left. I have just one question that I didn't want to leave unanswered from the audience, which is the following. Hi, Tiago. Great to hear all the right messages here. Thank you. Yet, Program for Transport Day at COP26 mainly talks about electric vehicles and technology. How do we get the message across to the negotiators? Well, what I can tell is that WHO will be working relentlessly to influence those discussions, not only on Transport Day, but also on the Cities Day, as you heard before. And I would like to put my colleagues on the spot here, all of you. And in the 1.5 minutes that we have left, I would kindly invite you to deliver one short sentence with a key takeaway, not just for the audience, but for those negotiating on the Transport Day and on the Cities Day, and to see if our voice can somehow influence that discussion taking place in the official program. I would like to follow the same sequence. So, Olivier, the floor is yours. One short key takeaway message for us.
Yeah. As I thought, I think that one important thing is to better use what we have, better use our infrastructure, to better use our space, to better use our building. This is one key to reach carbon neutrality.
Bingo. Natalia.
I think it's key to build infrastructure. And I think this is what we're lacking, for example, in South America, in our cities. If we don't have infrastructure, we won't be able to promote biking. People won't risk their lives if they, or to stop climate change if they don't have infrastructure. Infrastructure will also help get a gender approach to biking. So infrastructure is key for everything, and also the support of the youth for these programs. This is the key to changing, the mobility paradigm.
More infrastructure and youth participation. Excellent. Mohammed.
Yeah, I would say that the Paris Agreement will not be achieved without public transport, and we don't need more technology for that. We know how to do. We know how to achieve the objective. What we need is political will. So we need to make sure that public transport is included in all NDCs. That's the objective. And thank you.
That's excellent. Excellent. Heather.
Yes, it's such a great point. And we actually have a study coming out just after the COP to address this very issue. And our modeling essentially shows if we just focus on electrifying private vehicles, we do not make our 1.5-degree target, and that we absolutely need compact cities, public transit, and walking and cycling. And if we just focus on private vehicles, the demand on the electricity, and we know renewable energy is already a challenge, would be 40% higher. And we don't have the time or the money to meet our climate targets as urgently as we need. So we have to focus on electrifying the public transport sector, not just private vehicles.
And we know how to do it. Excellent.
And we know how to do it.
We know how to do it. Sandra.
Yeah, I guess being representing CDP, I would just say continue to follow the data, help cities and others develop, greater metrics so that we can continue to make that case convincingly and clearly. They want to do the work. We just need to support them in doing that.
That's excellent, Sandra. Colleagues, Olivier, Natalia, Sandra, Heather, Mohammed, dear Health Minister of Argentina, Maria Neira, Milan, it's been an immense pleasure to have you in this discussion today. Let's continue these efforts. Let's act now for more sustainable, healthier transport systems and urban environments. Not in 30 years, in 1 year, in 2 years, now. Thank you very much.
Thank you.
Thank you.
Thank you.
Thanks, Diego.
Thank you.
Bye.
Bye-bye.
Thanks. Hello. Good morning, all. Thanks to the organization, thanks to WHO and the Global Climate and Health Alliance to allow us to have this presentation here at the Health Pavilion in the COP26 in Glasgow. Well, first of all, I'd like to thank first the organization and also to give us the opportunity to make this presentation in this big event which is taking place during these days. Well, my presentation is going to be focused on how the organization I represent here, which is Médecins du Monde, Doctors of the World, international, and specifically in the organization that we are placed in Spain, Médecins du Monde Spain, what we are doing in terms of our strategy to reduce our carbon footprint, which is a kind of initiative which is taking place since 2016 now. And well, it's something that we thought that perhaps as a case study could be shared with all those attendees of this conference, and to have the ways to find how an organization like a non-governmental organization like Médecins du Monde has been able to reduce our carbon footprint since 5 years now. So I don't know if I have the access to the slides. Okay, perfect. So next, please. All right, so first of all, it is a very brief introduction of our organization. Very quickly, it's Doctors of the World, was set up in 1989. So it's a long time now that our organization has been actively working in favor of the right to health of the most vulnerable all over the world. So as you see here in the presentation, we are working in 74 countries all over the world. We are now approximately implementing around 330 programs to improve the access to healthcare for everyone. And we are giving access to healthcare for almost 6 million people in many countries, in developing countries, and also in the northern countries. So it is also relevant for us to share with you which is our mission. That is specifically, we mean with our organization and with our goals that we are independent international voluntary movement. So it is the membership of our organization is including overall volunteer people who are participating in the activities and also in the designing of our strategies globally. So we are trying to implement innovative medical programs and evidence-based advocacy. So then we can get empowered excluded people and communities to claim, this is very important for us, to claim their right to health, while at the same time we are fighting for universal access to healthcare. So these are the three concepts that we are very happy to share with you, which is we are a voluntary movement. We try to empower the population we work with, and always within the framework of the right to health. So this is something that we want to highlight. So in the end, we are 17 officers working in 17 countries, which is, we call it chapters. You can see the list of the countries that we are working as at headquarters. But as you see, so there are 74 countries that we are working mostly in developing countries. So this is just a very brief introduction of what's our organization. So more specifically, next slide, please. More specifically, this is the strategy we want to share with you. Is from the Spain chapter of Médecins du Monde, Doctors of the World. So it is something that it was decided some years ago. So starting in 2016, the board members of our organization make the decision to actively include in our strategies the environment and climate change as one of the priority topics for our organizations from that time on, and in an increasingly way. So it's very important for us to highlight how we include the priorities in our strategic plan. Now, MDM Spain, Med San Dumont Spain, we are finishing our last strategic plan, which started precisely in 2016, and it ends next year, 2022. So this is the way we included in our working plan, in our strategic plan, the way how to address environmental determinants of health, and including climate crisis. So there are two specific goals where we highlight the needs of addressing this topic, which is to include the environmental approach within our mission by raising awareness, building capacity, and implementing the necessary tools, and also to contribute to the sustainability of the environment by reducing the impact of our activities through implementing a number of tools and means that we've been designing and developing through these years to facilitate the mainstreaming of this topic in the organization. So next slide, please. So what's our approach in terms of environmental approach of MDM? So we are here, it's very quite simple. So it's very well known. This is the WHO strategy in terms of the environment and health. So here you can see a very useful infography where you will find which are the different elements, different factors, environmental determinants of health. So you will see that there are air pollution, inadequate water sanitation, chemicals, radiation, community noise, occupational risk, agricultural practices, built environments, including climate change or climate crisis. So these are the elements that we are now working with, taking into account this environmental determinants of health approach of WHO. So this is the approach that we also assume within our organization as the guidance for our prioritization of the work we are doing all over the world. So next slide, please. So within this environmental approach, we decided to focus our interventions in 3 different areas. So one of them is how to make more sustainable the management of the resources that we are using in our daily work. This is one of the big areas we are focusing our work in terms of environment and climate crisis approach. Another one is how to approach specifically these determinants of health, environmental determinants of health that I was mentioning before: noise, pollution, water sanitation, climate crisis, etc. And also, on the other hand, this is the third big element of our strategy, is reducing the greenhouse gas emission. So in terms of mitigation, how Med San Dumont can contribute as organization, international organization, to reduce our carbon footprint. So how we did it? So next slide, please. So this is we were at that time in 2016, when it was decided to start implementing this strategy of reducing our carbon footprint, we did a work of trying to identify those institutions, international institutions, that could provide us with the best tools to make our calculations, how to better calculate our carbon footprint and how to reduce it, what it means to reduce it. So in the end, it was identified that one of the most prestigious institutions internationally, which is the Greenhouse Gas Protocol. So this is the means that we are using as the main framework for establishing the criteria for MDM to finally decide on how to prioritize our actions to reduce our carbon footprint. So as you can see there, the Greenhouse Gas Protocol is an international entity which is including the World Business Council for Sustainable Development and the World Resources Institute. So they set a number of tools and criteria for any institution, state, private company, or organizations to start initiating a process of reduction of carbon footprint. So you see there a number. These are the three main areas with the criteria using within each one of them. So this is what is called the three scopes. So the first scope is those direct emissions, in this case of greenhouse gases emissions. So direct emission of the organization in our case. So scope 2 and scope 3 are the indirect gas emission of any institution, state, organization, as I said before. So in this case, as you see there are a number of elements that are identified within each one of these scopes. So these are specifically the tools that we've been using to identify the elements that we need to work with to reduce our carbon footprint. So please, if you can click in the link, thank you. Just for you to see which the content. This is the website of this institution that we've been working with. So just for you to know that if you are interested in, perhaps you can have a look at what they are doing and which are the tools they are providing to the organizations to. You see the number of projects that they are working with. So this is very quite interesting. Okay, so next slide, please. So within all the criteria included in the tools of this institution that we are following, so we selected a number of them for us to proceed with our diagnosis of how much gas emissions we were producing in our institution, organization in Spain. So these are the criteria. As you see there, there are three scopes, as I mentioned before. So in the scope 1, which are the direct emission sources, so it is the natural gas, the diesel and gasoline that we need to consume for the activities that we are implementing. So you see, in terms of natural gas, it is the natural gas that we consume in the facilities of our property we own. So if we are using the gas in producing the heating, for instance, in the buildings that where we are working in. Also, the fuel that we are using for the vehicles, the cars, the vans that we use in our daily work. So also, which are the gases that we are now identifying, which is the CO2, N2O, and the methane, so it's CH4. So these are the gases that we are identified. In terms of the scope 2 and 3, which are the indirect emissions, so we identified like the power supply of our buildings, our facilities. So which are the companies that are supplying the power in our institutions, and also we try to find out if were there are any alternatives or green alternatives for the current companies that were supplying the power in our facilities at that time. So finally, the third scope is also indirect emissions, and we selected the use of paper, which is one of the goods that we are consuming in a high rate, and also the gas emissions of the transport that the employees of our organizations use every day in our everyday day work. So you see in the paper consumption in our facilities, also the fuel consumption of our employees in travel business, both national and also abroad, and also the commuting when our employees, our staff is commuting from their house, the home, to the work they work with. So these are the criteria we took into account. So next slide, please. So for MDM, we have 21 offices in Spain. Let me tell you that this first diagnosis was done only for MDM Spain projects implemented in Spain, not the projects that we are implementing abroad in other countries. Okay, the first step we took was to identify and to make a diagnosis of our carbon footprint in Spain in the project that we are implementing in Spain. So in Spain we have 21 offices in the whole country, where we have 163 staff people working, and 200 and so, some of them 163 women, 62 men, with also 547 staff working in other countries, and with cooperants, volunteers, donors, and partners. So we are focusing our interventions in three main areas. One of them is international development, projects that we are developing in other countries. Also projects that we call social inclusions. Most of them are implemented in Spain, and for vulnerable people living in Spain who lack access to healthcare services. And finally, also advocating and communicating and campaigning in favor of universal healthcare access and the right to health. So these are the three main areas. So this diagnosis in terms of reduction of carbon footprint has been done only in Spain for the projects we are implementing there. So this is very important. So next slide, please. So what we did first was in 2016 was to develop the first, like the baseline and the first diagnosis of the gas emission of our facilities, transport, etc. at that time. So that became our baseline for us to take as the first step for the calculations and the comparing analysis when further on in next years we were doing the same. So as you can see there, in total figures we find that in 2016 we were emitting 505 tons of CO2 equivalent in Spain, only in Spain, all right? So if you see the graphic in the right-hand side, the red area is for CO2. As you can see, 99% of the gas emissions of MDM Spain at that time was mostly in CO2. So a very little quantity in methane or N2O or other fluoride gases. So yes, next slide, please. So then, after we did our diagnosis, we decided to find out how we could plan for the next years, for this current strategic plan for the next 4 or 5 years, how to reduce our carbon footprint. So these are the initiatives we planned at that time to put in place. So for the scope 1, for the direct emissions, so we decided to substitute at least 10% of our vehicles with hybrid or electrics. So our expectations were to try to reduce 7% of our emissions with these 10% of substitutions of our vehicles, our cars, vans, trucks, into hybrids or electrics. So which is the indicator we are using to know if finally or actually we are reducing in that percentage? It's the fuel consumed when traveling. So if we are reducing the fuel we are consuming, so we can guarantee that we are being successful in our strategy to reduce first the direct emissions. For the scope 2 and the scope 3, for the indirect emissions, we decided to purchase renewable sources for power supply. This was something key for us, and I will show you later on in my presentation. So in this case, it was to reduce the electricity consumption in our facilities. So at that time, the goal that we established was to reduce in 4%, okay, for the final period of our strategic plan, which is the indicator we are using to know that we are reducing our electricity consumption. So the invoices, the amounts, the cost of our electricity consumption in the end. So for the scope 3, so we were also identifying to foster car sharing rather than using one car by one person. Also foster alternative transports, public transports, Also, efficient driving protocol implementation, due that our projects require a high intense rate of mobility and using of transport, because we are moving to the places where vulnerable population are lacking access to healthcare. So that's why we need to use the use of cars, vans to approach, to outreach those vulnerable populations that we work with. So that's why we decided that we needed to improve the efficiency of the driving when we are commuting or going to the places that we are implementing the projects. And finally, replacement of travels by video conferences. So I will show you later on how that had to be done necessarily because of the pandemic. So that was a great opportunity for our organization to know how to do it, how to reduce the travels of in our projects and change those into video conferences, substitute into video conference and online meetings, online activities, online trainings. So how could we identify that this could be done in terms of reduction? So again, to find out how much fuel we were consuming and if this fuel was reduced. So that was one of the other indicators that we are using. And finally, within this third scope of indirect emissions, how to reduce a 30% of the use of paper and optimizing the use of documentation in our offices, in our facilities. So in this case, we try to at least 9.2% reduction of consumption of paper. So you see that there are but small quantities. So we were quite humble at that time. So we weren't very much ambitious at that time, because we thought that perhaps it was going to take some time for us to learn how to do it. So that's why we decided that it had to be done very humbly at the first time. So the only more ambitious target that we put at that time was for the scope 3 in terms of replacing travels by video conferences, that we decided that 50% could be reached by the end of these 5 years. So, well, this is something that later on I'll show you if finally we could achieve or not. So next slide, please. So the next thing we did was to try to put in place these initiatives, these actions in the following years. So the next year, in 2017, we assessed again, we did again the diagnosis. So for us to have ways to compare and to find out if we finally were achieving some positive results or not. So you can see there, this is a very simple table. You see that in the different scopes, we had different results. So for the scope 1, for the direct emissions, we couldn't achieve the targets that we identified at the beginning. So moreover, we increased a bit the amount of CO2 emitted. So we went from 37 to 40. So we increased a 3%. So 3 tons of CO2 equivalent in this year. So we were not successful in terms of the direct emissions. For the second one, the scope 2, indirect emissions, it was a small reduction of 5 tons CO2. And for the third scope, we reduced a bit also our emissions in terms of tons of CO2 equivalent emitted. So, well, in general terms, for the 3 scopes, we could get a little reduction in the next year. So from 505 tons of CO2 to 575. So very little. In 2018, we didn't do the diagnosis again, so we skipped that year, and we did the next diagnosis in 2018. So these are the results. Next slide, please. These are the results we reached in 2018. So you can see the comparison between the 3 years. 2009, yes, that's fine. So you can see that in terms of direct emissions, we remained the same. So we didn't increase, but we didn't decrease. So we remain equal. comparing with previous years. So for the other scopes, for instance, it was quite successful, and this is a very good experience for us. So in terms of the indirect emissions for electricity purchase, we went from 45 tons to 0. How we did it? Because that's really amazing. How this means that we decided not to use anymore the electricity? No, that's not the thing it was. So what we did was we changed the company. We were purchasing the electricity, the power we were using in our facilities. So the company we decided to stop having the relationship with the former company, and the new one was a company ensuring that 100% of the electricity we were consuming came from renewable resources, from windmills, solar panels, hydroelectric. So 100% of the electricity we were purchasing from that moment on were coming from these renewable and green energy resources. So that was really successful for us in terms of reducing our carbon footprint at that time. So that's why it was really relevant for us. And for the third scope, also for paper consumption and also the commuting of our staff and business travels. So also we reduced a bit significantly comparing with, in this case we increase a lot. We increase a lot because of one of main reasons. So since 2016 and 17 till 2019, our activity increased a lot. So we could get lots of funds. So we almost doubled the activity since 2017 to 2019. So there was also many new projects, many new interventions, many new activities were implemented and developed by our offices in Spain. So that's why the emissions increased because of our increase of activity. So at that time we analyzed these results and we tried to find ways to how to reduce our emissions, although we were increasing our activity. So that's what we tried to do. So next slide, please. Okay, so what happened in 2020? Well, unfortunately, as we all know, so it was the pandemic. So that was one of the main reasons why in our organizations, the activities that we developed, we had an incredible decrease of emissions of CO2, but that was quite logical if you think in terms of the limited mobility that we had when the pandemics and the confinements measures, etc. So that was one of the main reasons why all the emissions decreased a lot during that year in the projects that we were developing. So here we can say that 65% of the reduction of CO2 is due to the pandemic and the decrease mainly in the mobility and the lack of, and the less use of transport means mainly. So the reduction of commuting, also the staff working in our projects, they stay at home and they started working online. So that's why also it was reduced significantly the mobility of our staff. Although, as I said before, our activity increased a lot because of many interventions had to be done in terms of attending, also assisting vulnerable population who were lacking of access to healthcare services during that period of time within the pandemic period. Okay. So next slide, please. So here you will see a comparison between the different years when we were implementing this carbon footprint strategy. And you can see there how, in which extent the carbon footprint was reduced during this period of time. So take into account that these emissions came from the projects and activity that we were developing only in Spain, not in the projects that we are implementing in other countries. So here you see there is, this is significant to see how in different years, in different scopes, we've been reducing because of different reasons. We've been reducing our carbon footprint. And well, because of 2020 was very special because of the pandemic, we can say that the reduction of our carbon footprint has been really successful because of even though during the pandemic the mobility was reduced significantly, the activity that we had to develop was really high at that time. So you see in this case the final row, you see that the reduction in the end after these 4 years was 55%. So comparing with the humble ambition that we have at the beginning with percentages of 10%, 7%, etc., we can say that we've been really successful during this year. So we could be able to reduce our carbon footprint in more than 50%, which is really amazing for us. So it was really surprising for us that all the staff working in MDM was really committed since the beginning. So training sessions were organized for our staff to learn how to do it in the 21 offices in our country. So I mean that's why we can feel quite proud of the efforts that were taking place during this time. Next slide, please. So which are the main lessons learned and findings of this experience during these years? So yeah, in terms of the scope 1 and 3, so the direct and indirect emissions, so we can say that the pandemic took a strong role here during this period of time. Also putting in place, implementing the hybrid work tools. This has been really important for us. So we have learned how to substitute in presence or face-to-face interventions or meeting and turn those into online interventions, online training, online meetings that has saved a lot of gas emissions. Also, the commitment of our organizations to put in place those measures has been really relevant, because I think this is one of the most important things for any institution, any organization which wants to put in place one or wants to develop one initiative like this one, which is the commitment of the whole organization. So starting with the board, also with the staff, and also with the beneficiaries, for the people we are working with. So we were all committed. So the commitment of the whole people working in the organizations is really key, because otherwise it will be really challenging and difficult to develop these initiatives if we don't have the agreement, the commitment, and also the willingness of all the people who are engaged and involved in this initiative. So for the scope, the second one, as I said before, it was really important, it was really key for us, the electricity company we were working with. So changing the contract from one company, electricity company, which were supplying us with electricity coming from fuels and fossil fuel resources, into a renewable energy and green energy company. It was really one of the key points for us here in successful changes. And well, just for you to have a hint on the huge change that supposed for us this initiative was that although the budget of MDM increased a lot during these years, so it almost doubled since 2016 until 2020, and the staff increase doubled, also our activity also double-folded in these years, we could reduce our carbon footprint. So this is something, it was a very good news for us. So from what's going on from now on, so next slide please. So now we are in 2021, so The last diagnosis that we did was last year, so now we are in the process of doing the diagnosis of what was going on in last year, so for 2021, to establish a new strategy. So in 2020, it was really a turning point for our organizations in terms of this initiative or strategy. So at that time, last year, we decided to also include the countries where we are working abroad. So from 2020, we started including the first diagnosis of our carbon footprint in our facilities, the projects that we were implementing in other countries. So you see there's a long list of countries that MDM Spain is working. So 17 new countries, more than just Spain. So 17 new countries were included in this new strategy. So next slide, please. So there you can see in 2021, after doing the first diagnosis in these other 17 countries, so we could get a first picture of the gas emissions of our 17 countries intervention projects. So then it allowed us to redesign again and replan again for the next 2 years, for 2021 and 2022, until the end of our strategic plan. So the targets to be accomplished by the end of this strategic plan. So you see there, only for Spain, in the different scopes, we have decided that we were going to try to be able to reduce 10% of our gas emissions in each of the 3 scopes. So for 2022, so our target is to try to reduce from 22 tons CO2 equivalent in 2020 to 19, if possible. Well, we are trying to remain the same for the scope 2, from 0 to 0, so we're trying to not increase again. And also, in terms of the scope 3, to reduce from 207 tons to 188, if possible. So this is only for Spain. And what about the other 17 countries? So for the scope 1, the current value it was identified in this diagnosis that we did in 2020. So we identified 294 tons of CO2 equivalent, and our target is reducing in 10%, and it is the same for scope 2 and scope 3. So from 104 in scope 2 to 94, and from 385 to 350. So a reduction of 10% is the expected outcome in the next 2 years. So how are we going to do this? So next slide, please. So we are going, this is the strategy we are going to try to follow up in the next 2 years to reduce in 10%, at least 10% in these different scopes. So for scope 1, you see there 3 different initiatives, 3 different goals, which is first, fostering efficient driving according to a manual that we have produced for our staff to learn how to drive more efficiently, so that we consume less fuel in our transports. So secondly, we are going to minimize the movements of our vehicles. So how to better plan the movements of our vehicles, how to foster online meetings rather than in presence of face-to-face meetings, also how to foster car sharing, so just to be more efficient. And finally, for this first scope, to replace vehicles by electrics or hybrids, so to continue our policy of reducing or changing our old fuel fossil vehicles and to purchase new electrical ones. So this is for scope 1. For scope 2, in terms of electricity reduction, as I said before, so we are going to keep trying reducing our consumption in our facilities, so so switching off lights when are not needed, etc., etc. So also, as I said before, hiring green energy or renewable energy companies linked with social economy. And thirdly, installing solar panels in our offices, not only in Spain, but also in those facilities that we have in other countries. So, and finally, for the scope 3, these are the 3 next following initiatives or goals. The first is reducing the consumption of goods, of materials. So try to recycle more, reuse, especially paper, which is one of the goods that we use more, we consume more. So in terms also the more efficient and sustainable purchase and procurement policies, so put in place these purchasing and procurement policies. So which are the providers that they are providing us with our goods and that are sorry, there's some noise here in this place. So, but in the end, so also reducing the travels that we need to use for our projects. And finally, reducing commuting. So trying to keep with our online work policies. So in the end, what's our philosophy here? So next slide, please. Our philosophy is summarized in this well very simple slide. So you'll see a broom. So in this case, what is more efficient in terms of climate crisis, in terms of reducing our carbon footprint? Perhaps consuming our electricity from green energy, but we keep using our Hoover, or perhaps it's better to broom when we need to clean the floor. So perhaps it's better to try to find ways to clean the floor with a broom rather than to keep using the Hoover that requires power and electricity, even though this electricity is coming from green energy, but perhaps it's worth it to put some thought and try to find ways to reduce our consumption as much as possible. So this is our philosophy. So this is one of the things that it's kind of one of the principles we are trying to follow. So, and then there are another ways to also reduce our carbon footprint. Yes, next slide, please. So it is what we call the carbon footprint compensation. So when MDM decided to begin this journey in 2016, and we decided to find ways to reduce our carbon footprint. At that time, that all the initiative, all the actions that were put in place were, as you have seen before, is how to reduce our gas emissions. So, but in the end, although we are able to reduce significantly our gas emissions, there will always be a remaining part of our work that keeps producing CO2 somehow. So what can we do? What can we do with these emissions, remaining emissions that we cannot avoid? So there are also choices that we can also take advantage of to try to also compensate somehow this CO2 that we are emitting in our activity, in our projects, interventions, etc. So these are the different choices we have in front of us. So before us, we have at least, of course, to prevent emission, but secondly, we can capture equivalent tons of CO2 of those tons that we are emitting through what is called the absorption projects, and finally through the voluntary carbon markets. This is something that we are not doing yet. So this is something that it is now under discussion in our organization. Okay, so this is not something that we have implemented yet. This is something that we need to discuss quite deeply, because there are things that we are we find that perhaps we need to find ways of how to find alternative ways. So this is all these choices are related to this offsetting the CO2 emitted. So offsetting is something that needs to be discussed in our organization. So this is not something that it's decided yet. So well, we will need to find ways of how to develop this idea, or if we keep going on with that or not. So next slide, please. So these are the two strategies that we are thinking of trying to implement in the next years if we finally decide that we want to keep on with this strategy. So first is to sum up all the emissions that we are producing and supporting projects, absorption projects in other places to compensate this gas emission. This is the strategy one. And the second strategy is in all these locations that we are implementing our interventions, both in Spain and in other countries, to find projects there in those places, specific projects which can compensate the CO2 emissions that we are producing in that location. So these are the two different ways of approaching these compensation initiatives. One of them is summing up all the CO2 produced and finding projects, global projects that can compensate the global emission, or finding small projects in those locations where we are working. So these are the two choices that are before us that, as I said before, we need to think about it. So next slide, please. So in terms of the investment or that we need to get in to get these initiatives done in terms of compensation, as you can see nowadays in 2020 we are emitting 772 tons of CO2 equivalent. So even though we have reduced significantly the emissions regarding previous years, we need to compensate somehow the current emission that we are producing. So how much could it cost for our organization? So we have made some calculations identifying the cost of the projects that we identified, as I said before. So it could cost us really is not too much. So it's between 6,000 and 12,000 euros to compensate in terms of projects, compensation projects or absorption projects in other places or with other organizations. And the cost differ by location and by the extent of preservation, but it is estimated also that it can cost between 2 and 50 euros per ton. So it's not that much. So it's really cheap to compensate with other, like for instance, reforestation projects, planting trees in places where they are deserted, for instance, or contributing to green energy projects that they implement in other organizations in other countries, or for instance, how to also funding projects of other organizations which are working in reducing the use of stoves within the households, for instance, which is one of the main sources of pollution within households in many communities. So, well, these are the projects that we are thinking of. So, next slide, please. So, just a very brief hint of which are the projects that we are being identifying as likely candidates for our compensation policies in our organization for the next years. Always, again, let me insist that we are not, we didn't decide yet if we are going to proceed with this work line, but okay, in the case that we are doing it, these are different choices that we have. There is one Spanish fund, which is Zero CO2, that they are implementing projects that reduction carbon footprint in some countries, in Peru, Nicaragua, China, and Colombia. So the cost by ton of CO2 is 6 euros, 10 euros, it's almost nothing, so it's quite cheap. So also the Ministry of Ecologic Transition of Spain also has a kind of portfolio of projects or initiatives that also can be funded, and that's also very interesting for us working in Spain. There is also another private initiative which is called Gold Standard. Perhaps we can show a bit this Gold Standard website for you to just have a look at the website. No? Okay, no problem. So later on, we will share with you the presentation. So Gold Standard is one initiative, international initiative, that they also provide with projects that any organization, institution that wants to develop or fund compensation projects, they have also a huge portfolio of projects that can be funded with our sources. So as you see there, with an average of $10 to $25 per ton of CO2 equivalent, you can fund projects in more than 30 countries, including Mozambique, Guatemala, Mexico, Honduras. Also, there is the United Nations Carbon Offset Platform that you also can help provide some funds for this project. So 23 countries, including Salvador and Guatemala. And there is another initiative which is called Carbon Sink, that they've got projects in almost 12 countries. So, well, these are only examples of which could be the candidates for our organization, for MDM, for this compensation project. So, well, I finish here. Next slide, please. So, we have produced a number of resources that can be found online. So, if you wish, I can provide you with these resources. Most of them are in English. Only one of them is only in Spanish, sorry. So it is one policy document we drafted on COVID-19 and its effects on the environment. So this is the only one which is in Spanish. The other ones are in English. So these are those manuals and guidelines that we have produced for our staff to mainstream this carbon footprint reduction strategy. So, well, this is something that can be provided. Next slide, please. So there you have my contact details, just in case you want to contact me. So you can reach me anytime you need for any consultation, anything, any clarification, additional information, or if you need, you want me to forward you the documents I mentioned before, I will be really happy to share this or additional information. So, well, thank you very much. And I don't know, perhaps we have 5 minutes for the session to finish. So if anyone has any question, perhaps in the chat, in this team, or people here in the room, I'll be happy to answer if I can the questions you pose. Okay, that's and one question here. So I deliver the microphone.
Thank you very much. This is a very impressive and very educational seminar for me. I'm Dr. Kenneth Liao. I'm the Director of Medical Development of Tzu Chi Foundation. It's TZUCHI. Oh. Thank you very much. You hear me now? Thank you very much for a very productive, very educational seminar for me. I'm Dr. Kenneth Liao, the Director of Medical Development from Tzu Chi Foundation. I'll share you the information. It's TZICHU, based in LA, USA. We are an interfaith Buddhist organization, but we involve in charity medicine also. So my first question is, you talk about a lot of this carbon footprint reduction. We are a faith-based Buddhist, so we implement and we recommend plant-based diet, which is very nutritious and also good for the medical profession and patients. And are you in MDM promoting this plant-based diet? That's question one. Question two is, your funding is very impressive. How do you get the fundings, or where do you get the fundings from? These are the two questions. Thank you.
Okay, thanks a lot. Thanks a lot for your questions. I'm going to try to see if I am able to answer properly the questions. All right, for the first one, in terms of the plant-based initiatives in our organizations, not yet, but we are working in a new strategic plan from 2022 onwards for the next 3 years until 2025. So we are trying to implement one specific strategy in what we call it's a care policy. Care policy. It means that we want to increase the a caring approach of all the things that we are doing in our organization. And one of them, of course, will be how we feed ourselves and how can we better improve the nutrition also aspects of how we feed ourselves. So this is something that perhaps we are going to be implementing in the next years. Not now, but this is a very good idea. I'm taking notes. I find it really interesting. And the second one, in terms of the fund, our funds come from public institutions and for private institutions and from our donors. So plenty of donors we have in MDM, Médecins du Monde. So we have partners who are donating yearly, in a yearly basis. Also we have specific projects, programs being funded by private institutions, foundations, and also by public institutions, by governments. In our case, in Médecins du Monde Spain, by the Spanish government, also by regional governments, also by municipalities, local institutions, and also by European Union also, and also from international funds, the United Nations, among others. Yeah, we have a diverse way of reaching the funds for our organization. Okay, thank you. So, no more questions. Well, thank you very much to all of you, and I hope it was fruitful, the conversation today. Thank you.